Hello, my name is Dr. Abel Bello, and I'm a practicing surgeon in Florida in private practice. And I'm going to talk to you today about how does the practicing surgeon stay current with advances in technology and implement them into the current everyday practice. My only disclosure is that I am a consultant for Ethicon Endosurgery as a proctor for the LINX reflux procedure. Why is it important to stay up to date with technology? In today's world, it doesn't matter the field in which you're in, you have to stay up to date because the technology is influencing your personal life and your professional life. The technology has been increasing rapidly over the last decades, and things that were previously thought to be impossible are actually now made possible. We also need to know about the advancement in technologies because it is fascinating to the mind. The old technologies that we used to work are not going to be useful in the future. And you also have to gain an advantage in the field as you stay up to date with technology. We have noticed that medical knowledge has been expanding exponentially and so fast that the information that we used to compile over 50 years, now it doubles in about 73 days according to research studies. So healthcare professionals really struggle to keep up to date with all of the information that is coming up and all of the new technologies and developments. It is also good to understand that as we search for new technologies and new procedures to implement, we also need to understand the current standard practice. New surgical technology offers a promise of improved patient outcomes and is very attractive. However, surgical procedures that are later found to be ineffective may represent a waste of resources and endanger lives. On the contrary, therapies that are sound may give the patient and the surgeons a leading edge. So how do we stay current? Number one of the main sources of information comes from patients and your peers. The patients are exposed to a broad number of informations, including news and medias and the internet and social media. They come to you requesting a specific service or technology. You may not necessarily know about it. As the demand increases, it starts triggering more relevant information that will become useful to your practice because of the demand. Another way to stay up to date is by being exposed to colleagues through different means, community exposure, social media engagement, and the daily talk with our peers. We also stay current by finding innovators in the field, and it's recommended or suggested to follow them. You may follow blogs, subscribe to newsletters, follow industry leaders on social media. If you're not sure where to start, you can ask one of your previous mentors or preceptors about what they do to stay current and who do they follow. You will learn that new technologies and techniques are a matter of trend, and as you continue to follow those trends, it starts generating more interest in the things that are relevant to you and your practice, and it'll help you focus and narrow down your options as you conquer new techniques. Another option is to read journals. Multiple journals are available in the field of surgery and they're constantly emerging. The journals are a wide variety. So if you want to narrow down your options, you may use resources like the New England Journal of Medicine Journal Watch or the American College of Physicians Journal Club. In those, the editorials, they tend to summarize and highlight the articles that are more relevant to you as well. Using clinical decision support systems is helpful as these systems are usually reviewed by a large editorial group and the information tends to be more up-to-date and current. One of the common systems known to us is UpToDate, but there are many other resources available to us online as well. Join professional organizations and attend conferences. The information may evolve faster than our meetings, in surgical conferences. However, what we notice in surgical conferences is that we tend to highlight the things that were more relevant the year prior or as part of the current standard. The different sessions of the conference also tend to promote and present current innovations via video presentations, surgical labs, animal labs, or any other short presentations, as well as review of the literature. E-learning and online courses have become a theme of the present and the future. There's a lot of resources available online, from courses, simulations, virtualized environments, meetings, and many other resources that we can use to learn about new technologies and innovations in surgery. Diversify your knowledge. And how do you diversify your knowledge? By being exposed to different wealth or different thoughts. Different thought process may come from academic surgery environments, events, community talks, conferences, industry sponsor events. You need to be exposed to all of these opinions so that you can make your own as well. You should pay attention to other vendor conferences, product announcements, and new publications about new products and research and innovations in surgery as well. Social media is a theme of the present. A lot of physicians find themselves joining groups of social media support in surgery primarily, where we can talk about different subjects, different topics. We can see different innovations from across the world, and we can also see indirectly outcomes about those procedures and innovations. It starts giving us a leading edge as to what we want when we implement an innovation into our practice or as we learn about new technologies. So what are the changes that we tend to implement? So surgical innovation is generally either a new procedure that uses existing devices or drugs, or an existing procedure that uses new devices or methods. So surgeons tend to be attracted to the new technology if they can passively observe, if they can implement it into the practice easily, quickly, and if it can be done without minimal disruption to the flow of the practice. So if the potential contribution to the practice is great, then the surgeons are more likely to invest more time and dedication to learn a more difficult approach. Now, the use of that new technology has the potential to provide patients with the best possible care, while at the same time reinforcing the professional vitality of the surgeon and the institution, which would tend to boost their image and provide a more competitive advantage. Now, conversely, if that decision is on the wrong side, it can lead to potentially sully reputations and waste of resources. So surgeons and institutions need to be vigilant and most guard against adopting a technology without solid evidence of its efficacy and superiority over alternatives. So the characteristics of the new technology adopted by surgeons usually is compatible with the current practice. It can be adequately supported in the available facilities where we practice. The surgeons can observe the procedure being done and can also attest to positive outcomes. The procedures can be offered to patients on a trial-based period. The procedure is also a simple modification of an existing procedure, or it can be easily learned by other surgeons. The volume of cases presenting to the hospital justifies the surgeon learning the new technique, and the procedure will appeal to patients. Other characteristics is that the patients will tend to demand for the technology. It needs to represent a low cost for the surgeon to learn the procedure or the technology. It may be motivated by industry and manufacturers' promotion of the technology. And also, it is very important to be cautious about assuming or implementing discredited technologies or procedures that may have a negative impact on your practice, and that at the same time may jeopardize or risk harm to patients. When we look at the implementation model, we have early adopters, we have innovators, and the early and late majority, which are most of the people. So we tend to see that the minority of the people in the innovator and early group tend to jump on the procedure a lot quicker. Those tend to get a leading edge. But at the same time, if this procedure tends to be abandoned over time because of lack of efficacy, then the more conservative group of surgeons are the ones that tend to be in the late majority adopters. So what are the steps in deciding to implement the technology? Will the technology improve the quality of care? Will the key early adopters will be also willing to promote the rapid and successful adoption of the technique? Are there incompatibilities with the social patterns and technologies already in place and how can they be resolved? So have we identified and evaluated all known and potential barriers to adoption? So those are key questions that we need to ask ourselves. And when we implement them into practice, one of the things is to balance the new and traditional approaches when implementing changes, finding a method that works for you, whatever works for you, whether animal lab, proctorship, or any other ways that you can explore and learn the technology. Make sure that you attend all those seminars, obtain proctorship if you need more tutoring. And also, it's very important to know that you need to build on the basis of techniques that you already control and manage. If not, then you need to dedicate more time to build those skills as you gradually increase and improve your experience for better outcomes. In a summary, the enthusiasm for new technologies has often led over the evidence. The adoption of new techniques follow different stages in the process. Adoption before efficacy has proved it may waste resources and harm patients, and technologies that is easily to use and applicable to a large number of patients is most likely to be adopted without evidence. Thank you very much.